According to this recent report, lower back pain is a problem that up to 84% of Americans will have to deal with at some point in their lives. In fact, this isn't even just a problem that only the aging population must deal with, as the statistics show that nearly half of all people will have dealt with some degree of back pain by the young age of 18 years old. Unfortunately, back pain usually isn't a one-time occurrence either. Instead, most back pain, once it starts, is chronic back pain and never really seems to go away. Fortunately, there are numerous ways you can alleviate this back pain for good. And no, I don't just mean temporarily, but forever. When people think of lower back pain, they often assume it's caused by an injury to one of their lower back muscles. However, most people don't understand the anatomy of the lower back, nor can most of them even name a single muscle in the lower back region. A major reason for this is that you can't see any of these muscles, as most of them are located deep and around the spine. These lower back muscles are known as the paraspinal muscles and include the psoas major, quadratus lumborum, and the erector spinae group. Don't worry, you don't have to memorize any of these muscles, as they all essentially perform the same function, which is to support the spine. With that said, you may have noticed that most of these muscles aren't just lower back muscles. Instead, most of them actually run along the entire length of your spine. In most cases though, these muscles undergo the most strain when trying to support the lower lumbar region of the spine, as there aren't many other muscles that can provide assistance here. For this reason, most lower back problems are caused by strains on these paraspinal muscles, usually as a result of lifting heavy objects that place high loads onto your spine, such as in barbell squats and deadlift. With that said, lower back pain is very difficult to diagnose, as sometimes the root cause of the pain isn't from lifting the heavy objects, nor is it even always the lower back muscles themselves that are being irritated. A common one you've probably heard before is that poor posture causes back pain. This is obviously true, as any bit of forward rounding is going to shift your body weight in a way that wants to pull your spine forward or cause it to round. Clearly, the muscles that support your spine don't want this to happen, so they have to work harder to resist this forward pull. Over time, this results in these muscles becoming extremely tight, which will eventually lead to muscular imbalances and pain. On that topic, muscular imbalances are often the leading cause of chronic muscle pains, and this is especially true for the lower back. This is because your lower back is part of the group of muscles that make up your core, along with your abdominals, your obliques, and although they play a much smaller role, the glutes and the lats as well. When any of these core muscles are weak, the others have to compensate by taking on more of the workload. Over time, this leads to the overworked muscles becoming extremely tight and injury prone, ultimately resulting in pain and discomfort. However, one such highly neglected muscle responsible for overworking the lower back muscles isn't even part of the core at all: the gluteus medius. This small muscle located above the massive gluteus maximus is a hip abductor that plays a crucial role in stabilizing the hips, particularly when one leg is off the ground. In fact, this is the muscle that allows you to keep your hips straight when walking. If you didn't have it, your hips would naturally jut out to the side with every step you take. When this muscle is weak, it's not able to keep your hips fully aligned. As a result, this slight shifting of your hips also slightly shifts your spine, which of course places more load on the muscles that support it, leading to tightness and pain over time. Apart from the gluteus medius, other muscles situated around the hips can be responsible for another type of lower back pain that's often the most painful: the impingement of the sciatic nerve, a condition known as sciatica. The sciatic nerve mainly becomes impinged as a result of a herniated disc in the spine, although it's also possible for small muscles around the hips, such as a piriformis, to become inflamed and put pressure on this nerve as well. Since it is a nerve pain, it is often pretty clear when you're dealing with sciatica, with the pain being felt not only in the lower back, but also radiating down through the glutes and legs. Another extremely common cause of lower back pain is joint related, often involving the sacroiliac or the SI joint. This SI pain can be caused by wear and tear, or it can be the result of an acute and sudden injury. If your lower back pain is SI related, you'll probably feel the pain on one side of your body, almost in between your lower back and your upper glute. As you can see, diagnosing and fixing back pain is not a simple task because of how many different factors there are that can cause it. Therefore, the only permanent solution that fixes your back pain is the one that fixes what is actually causing the problem, not the one that just fixes a part of the problem. No matter what is causing your back discomfort, resting should always be part of your recovery protocol. Every injury causes inflammation, which is simply just part of the healing process. The problem is this inflammation and swelling will only go down if the injury is left alone, as agitating it will only result in more inflammation, causing even more problems. Depending on the cause and severity of your pain, the time you spend resting your lower back will vary drastically, from as little as a few days or a week to multiple weeks or even months sometimes. However, as you can probably already guess, simply resting will only be a temporary fix, albeit a necessary one. While resting, you need to take a step back and address the obvious. Were you lifting heavier than you should have? Was the injury the result of you skipping your warm-ups? Or perhaps were you poorly managing your recovery and not allowing your lower back enough time to recover between heavy training sessions? Whatever conclusion you come to, these are all serious questions to ask yourself. If the cause of the problem was something as simple as this, you should address it and fix it before it grows into something more complex. Many times, regardless of the nature of your injury, there is some degree of muscle imbalance to blame. Fixing this imbalance should be the highest on your list of training priorities, although it can be difficult to narrow down where exactly the imbalance is. As I mentioned earlier, your lower back pain can be caused by other core muscles being weak, poor upper body posture, or from an underactive gluteus medius muscle. To fix this imbalance, you simply have to train the muscles that are causing the problem. If your abdominals are too weak, also start adding an additional ab workout or two every week. If your gluteus medius is too weak, start doing more hip abduction exercises and training with more single leg movements. If your upper body posture is bad, you'll likely just have to strengthen your upper back muscles more. Also, you should also consider whether or not it is just your lower back that is too weak compared to the other muscles. If this is the case, you'll probably feel it become very tight while doing movements like squats, deadlifts, and free weight rows. The fix to this issue is to dedicate more of your training to strengthening your lower back muscles with exercises such as good mornings and back extension. If you believe your lower back pain is a result of nerve impingement or a joint issue, fixing the issue can become much more complicated, however. For the most part, both issues are often resolved with rest to allow the joint to heal or the inflammation around the impinged nerve to lessen. However, depending on the severity of the problem, anti-inflammatory injections and surgery may be required to fix the problem permanently. With that being said, the only way to permanently solve your back pain problems will be to tackle the exact root cause of that problem. Even if you understand the cause of your pain and successfully fix the problem, the solution only remains permanent so as long as no other problems come up. For example, you may strengthen your underdeveloped abdominal muscles and find that it solved your back pain, but then find the back pain has returned, this time being the result of your glutes being too weak. In other words, the only way you can really avoid and solve chronic back pain forever is to avoid neglecting any muscle group, even the very minor ones. Know your limits to avoid lifting too heavy as well, and understand proper recovery so that your muscles are given enough time to recover between training sessions. Unfortunately, there's no way for us to know for a fact the exact strength and recovery status of our muscles. So much of this becomes a guessing game. Therefore, our ability to listen to our own bodies and interpret the red flags it provides us is the most important tool at our disposal. If you want a personalized program that will help you improve in these areas, then make sure you check out the links to my programs in the description box below. Thank you for watching my video, and as always, get busy, get after it, and God bless.